Arganissima, New York. Your exotic skin, hair, and beauty source, and your one-stop shop for all your natural and organic skin and hair care, featuring authentic organic Moroccan oil and prickly pear seed oil and much more. Bringing you only the best, straight from the source and proudly produced in the USA. So what are you waiting for? Shop today at www.arganissima.com. Arganissima, New York. Your beauty is our duty.
Folks, welcome back to the iHealth channel, iHealth Radio, with your host, Hurricane H. New day, new show, excellent topic. We all are moving and doing our thing, and some of us do a lot more through our physical activities and fitness and whatever programs we do, and sometimes without even doing that. Athletes do a lot of work. And one thing that always happens when you are active is you do get hurt. Unfortunately, it's part of the work that we do, and sometimes that can affect how you live. I mean, especially if you're doing something and that is your occupation, it can, have a detrimental effect. Now, we've had shows before and talked about physical therapy and chiropractic and stuff like that, but we never talked about occupational therapy and what does that mean and so on and so forth, and the trauma that happens after injury and how to treat it and how to deal with it. Well, with me today, I have a specialist, doctor in occupational therapy, also a best-selling author on Amazon. He is a coach, and he helps people kind of go from trauma into becoming who they were before and really helping them. So I have with me Keagan Hadley. Keagan, welcome to the show.
Thanks so much for having me.
It's a pleasure. And as I try to announce, the introduction of the show, literally, I'm a little familiar with occupational therapy, but I don't know if everybody knows the difference and what it means. If we can just start with that, and then also your background, and then we'll talk about the overall benefits of therapy, and then we'll talk about injury and so on and so forth. Let's get there.
Yep, it's the $1 million question. What is occupational therapy? It's definitely something that I've been asked many times, and even when I was in clinicals, you would walk in a patient's room. And they'd be an 85, 90-year-old person and say, "Oh no, I don't need a job anymore. I'm retired," and kind of those misconceptions. So it's basic occupational therapy is therapy that gets you back to the daily occupations that you enjoy, that make you you. So essentially that encompasses not only the physical aspects, but also the psychosocial aspects, because everyone tends to want to pry apart the mental side of things from the physical side of things, and it's all one big it's all one big piece to who you are. So we provide therapy that makes sure that you can get back to those things that you enjoy. Very commonly, especially in hospital settings, you see occupational therapists helping people do activities of daily living, which is essentially like getting dressed, making sure you can go to the bathroom to maintain your dignity and those kinds of things. But it also can stretch all the way to, again, as you mentioned, if an athlete or a person just in general highly identifies as, a football player, a soccer player, or whatever the case may be, and they're not able to do that anymore, it doesn't just affect, their physical being. It also affects their emotional being, their self-esteem, their, everything that makes them who they are. So it's definitely all tied together. And essentially what I focus on mostly is the psychological side of physical injuries for athletes, or athletes that are transitioning into the quote unquote real world after, college athletics is where I've been at, for quite a while. So.
Well, thank you, Keagan. So first of all, I appreciate, because it's funny because I'm in the insurance space and we do cover, all the different therapies. and it's one thing, to your point, it's a lot of folks that think it is physically just the ability to go back and do your functions at work. But you're right, this is beyond, and I think, and thank you for clarifying that, because just because, one thing is the job part of it and what you're doing functionality, but there's, to your point, everything else and how it affects your social aspect. And the psychological piece of it is probably, to your point, is the biggest part. And while we can fix the physical one, the emotional part is always a harder one, and it's probably more. I guess it has a better value, a better weight on how we behave in general, because our mental state is everything. If your mental state is good, your physical state is better. It's amazing how it all ties in and it's all one. And it's important to differentiate. Now, just a quick question. Now, are you by trade the same as, just for our audiences, the same I guess qualified the same qualified level in terms of physical therapy or any other therapy? Is that the same kind of education? Is that the same process to get to what you do? Just to differentiate, because I mean, again, people understand physical therapy, but what is the system that you have to go through, or the education process you have to go through to become a doctor in occupational therapy?
Yep. So a lot of the clinical doctorates, except for like MD and those kinds of things, are very much the same. So physical therapy and occupational therapy have essentially the same length of, a curriculum. Following undergrad, it's 3 to 3.5 years or so, roughly, depending on which school you go to and how rigorous it is as far as the number of credits. But physical therapy school looks, as far as duration, looks very similar to occupational therapy school, and it's much the same as the psychologists I've talked to as far as duration as well, if they're getting a PsyD. So those are kind of the two opposites, is physical therapy and PsyD, because it's totally mental and totally physical.
But you're focused more on the mental aspect than the physical. So
correct. I'm mainly firmly planted in the joint injury space. So again, I have a hard time separating the two, because your physical injury essentially is impacting your emotional and psychological health. So they're very much one and the same. But yes, I do kind of approach things from that angle specifically, because it's an under discussed topic, in my opinion, is the psychology of physical injuries.
Well, no, I love it, and that's why we have the show. Is that we all know that the body gets potentially fixed.
Yes.
But the damage, you can fix the body, in a surgery, whatever, and you do some therapy. But the scar that it's outside may vanish eventually. But if you're mentally, scarred, or you have, I don't know, whatever it is, it affected your well-being, your social status, and everything else, that can be a further, damage, and it can impact everything. I mean, you can get into depression, you can get into a lot of stuff. So that trauma piece is probably, worse than the actual physical aspect of it. Although I'm not, downplaying the actual damage itself, because we don't want that, to happen. So now let's talk about that. What are some of the, I guess, the serious damages that can happen in terms of joint anatomy, and then so let's talk about that first. I think it's a good start point, where we understand the trauma itself and the types of trauma that happen, and then let's talk about the impact on the psyche.
Yep. So of course, I specialize, I guess, in quotes, or I deal with people most frequently who have had a torn ACL. Because mostly because of the duration of the rehabilitation. It's not one of those joint injuries that heals on its own. It's usually the literature shows that the most effective an individual is at returning to their prior level of activity is after a year. So a year is a long time in an athlete's world. So those are what I deal with most commonly. I've also talked to individuals who have had Achilles injuries, not as many, but I've also had discussions with individuals who have had like Tommy John and those kinds of things, where they have kind of similar struggles. The joint that they always depended on, in pitchers' cases, it gave out on them, and getting that confidence and self-esteem back, and getting slowly back into essentially athletes' main coping mechanism is their sport. So if they're taken out of that for a year, that's a long time from the standpoint of life happens. Obviously your injury was not ideal, but even further into that, additional life will happen to you in a year. And if you don't have a way to cope with it and lean on, like athletes do with sports, you can find yourself in a world of hurt. So.
Well, so thank you. Now you mentioned ACL. Just again for
Mhm.
our audiences, if we can describe what that damage looks like for folks,
Mhm.
because I think we all prone potentially to have some sort of injury of that nature, and ACL is probably the most common one.
Yep. There's four main ligaments of the knee. There's the ACL or anterior cruciate ligament, the PCL or the posterior cruciate ligament that form an X kind of from your femur to your tibia. That's your thigh bone to your shin bone, respectively. That act essentially as the brakes or decelerators when you're running. So imagine, when you tear that, it kind of feels, or your legs operate more so like maybe a car without good brakes or those kinds of things. So those ligaments prevent the anterior translation or the forward movement of the femur on top of the tibia. There's also the collateral ligaments, the medial on the inside of your leg, and the lateral collateral ligament, obviously on the outside of your leg, that prevent excessive varus and valgus movements, which is kind of the more gruesome injuries you see on Sports Center, where you're a guy or a lady's knee moves in a very unnatural way. Those are more so the LCL or MCL involved injuries. Not saying that generally when your knee moves in those kinds of ways, you tear more than one ligament. But yeah. So that's kind of a general overview of the anatomy of the knee from a ligament standpoint.
So thank you, Doc. But now, what would cause a ligament to tear? I mean, in a way. I mean, I get it. Wear and tear or heavy or bad movement. So one is what would cause that. Two, how do we kind of make it stronger? And this is before we talk about the trauma of an injury. We just want to, just to give our audience something to take home. That obviously preventative stuff is always a key. And if you're careful enough, I mean, and that's the other thing. I mean, there is an age piece, right? Younger person versus an older person. What would be, some of the advice you would give people in that particular space?
So as far as why it happens, that's if I had the answer to that, I'd be doing very, very well. I think, because it'd be easy to stop if we could pinpoint exactly what causes these injuries. But a lot of times, especially with ACL injuries, for example, I've torn both of mine, obviously at different times. And it was non-contact injuries. I wasn't being, hit or anything at the time in football. And my leg just collapsed. It kind of rotated internally, maybe due to fatigue. I'm a kind of a lanky, or my limbs are very long. So, I mean, there's also speculation as far as maybe your Q angle, which is very prominent in girls as well. I have a larger Q angle for a guy. Maybe that contributed to it. But, I mean, it's really hard to say as far as what caused it. And how to, prevent it. I think a lot more joint-centric exercise programs need to be put in place, because a lot of the strength training that is, our athletes are put through are very specific ranges, and they're very specific muscles. And I'll give you an example. We spend a lot of time developing the posterior chain, which is very important for acceleration, but we don't really put as much emphasis on the muscles necessary for stopping. The decelerators, which obviously, if you're gonna put a gigantic engine in a car, you probably want to make sure it has good brakes. Otherwise, there's probably going to be an issue at some point. So I think that's one way to maybe alleviate some of these issues, as well as making sure that you're very symmetrical with your strength. One thing that, another thing that I've noticed, especially through both of my rehabilitations, is you start to accommodate, if your left knee is the one that just was injured, your, right knee or your right leg plus maybe your left hip might take over a little bit to kind of lessen the burden on that recently injured leg. So as much unilateral stuff as you can do is very beneficial, and as well as flexibility. A lot of people think that the more flexible you are, the less explosive you'll be. But if you look at some of the most athletic people, like Michael Jordan and stuff like that, the angles and the positions they were able to get in, was what made them the most athletic on the court, or it only, contributed to their success. So I would say those are kind of three main things that I've noticed through my experience and that of, some of the people that I've worked with in the past.
So thank you. So you mentioned strength training. I mean, for all of us, or at least for me, and when I hear that, I think muscle, right? I think building a nice mass and having a good. But we're talking about ligaments. So what's that connection? I mean, obviously, is it the more strength training, the better the muscle is, the better protection you have for your ligaments? Is that the rule?
It's a great question. So essentially, there's muscles that are crucial for joint health. There's the VMO, or it's the most medial or inside of the quad. So it's when you see someone walking with shorts on, it's kind of a teardrop shaped muscle near the kneecap. That one's extremely important for knee health because it's one of the first muscles that is activated when you slightly bend your knee or when your knee is completely bent. So if you're bending your knee as much as you can, the muscle that gets you out of that position is the portion of the vastus medialis muscle. And also when you're just starting to bend your knee, which are very, both very crucial positions in athletics. So strengthening muscles like that one, as well as the hamstrings, which connects, if you look at the anatomy of the hamstrings, it's going from the back of your leg to, actually, believe it or not, right, inferiorly, so below and medially to your kneecap is where your hamstring tendon is, and that's where it attaches. So it's attaching from the back to the front, very similar to the ACL. So it's kind of mimicking it from the muscle standpoint. So the stronger you can get those kind of muscles, the more likely you are to have better knee health, better knee function and those kinds of things. But also, when you're working out those kinds of muscles, you're in very bent positions, and they don't really have literature in it. But if you have severe knee pain and you actually can get in those positions and start working out, many times, if you're an individual that has a bad knee, say you squat one day, you're probably sore for, a couple, 2-3 days after that. And it's not just muscles. It's more, a lot of times it's your joint that's sore because you're putting pressure on it. But if you actually get in a deep squat, you have to obviously grade it quite a bit. So if you're not used to it, I wouldn't recommend just jamming your leg down in there, in that kind of position. But if you can slowly work your way into it and start getting accustomed to being in that position, you get more blood to the area and you feel better afterwards. So there's not any literature on it yet, but it definitely does. It's some of the stuff that I do still consistently makes me feel better after my workout, which was kind of when, I continued to pursue it, because anytime, I absolutely love working out, but if you're going to be sore every time after you work out, it kind of deters you from going as often as you need to be successful. So
well, thank you. And again, I'm listening to you and I'm almost visualizing what you're referring to. But we go to the gym, even in whatever you watch people, working out, a lot of weight is put on their knees, right? So squats are big, what do you call these? Like, jumping jack. Well, jumping jacks, not so much, but like, burpees,
yep.
all kind of stuff. So there's a lot of force that actually goes onto the legs and pressure. And then you have all these guys that do like, too much weight on them. And then, so the question is, obviously people do that because they want to get bigger and stuff, but the damage that can be happening over time is something that we have to be very, aware of. And listen, I mean, I don't think I've had an ACL problem so far, but I can tell you my joints over the years have been, hurting, because I've been in martial arts for 40 years. So I can just tell you the kicks and all the stuff and the jumping and the running. And then sometimes, or like, for example, you hit in, stuff all the time with your roundhouses, whatever, you do get a lot of pressure on your knees. And I have so many friends who have actually been with me that have had to do surgeries because of that.
Yeah.
And so it is, we all kind of tend to, when you're young, you're probably not going to feel it as much, but as the age goes on, it gets worse and worse. And now you can't even climb stairs. It's a problem. So you said it, there's not enough literature, to talk about some of these things. And so I appreciate you sharing that here. At least some people can hear about it and maybe apply some of this, and we also want them potentially to reach out to you. Maybe you can teach them more tricks. So that's just something I wanted to add. Now, I know you mentioned you torn 2 of your ACLs, on both legs. Now that's got to be probably one of the crucial, it's just the pain is going to be like kind of like almost, I don't know, unbearable when it happens. And then the healing process for that is probably worse because it takes long. I mean, and here's a question that is like, again, $1 million question. You said it, you were not even doing any activity and it just happened. So for people that are watching, because you think that it happened while you're doing an exercise, doing some sort of, fitness piece, but it didn't happen that way for you. And I know you wrote a book, and we're going to talk about the book. I think that's the core topic of the book. But it happened to you. So what was that experience like? I mean, just to visualize to people, and what was that time frame that you were able to go through, eventually get over? and I'm sure there was nobody to help you personally, I guess, in terms of the psychology piece and stuff. And that's why you do the work you do. So let's talk about that experience.
Yep. So I tore, again, both of my ACLs first, and the right, both playing first college football and then arena football, the second one. And I was doing a pass rush move. I played defense, and both times my leg in the back, because you have to kind of pivot sideways when you're going by one of the larger gentlemen. And both times my rear knee buckled to the inside, doing actually the same move both times. So I have a bit of an aversion towards the swim move now. But yeah, so that's what happened. And as far as the duration, it was very difficult from the standpoint of you never think it's going to happen to you, I guess, until it does. The only thing I really knew about ACLs when it happened to me the first time was, it was a big talking point on ESPN if someone had torn their ACL. So that's really all I knew. And I could almost feel my, aspirations melting away as I sat on those stupid carts they wheel you off on in football. So it was very difficult. And then I didn't have anyone that was really spoke to the psychological side of the injury, which is 100% why I do what I do, because I don't want anyone to feel isolated like I did when they're in that position. So.
Well, so thank you. But we hear about, sports injury all the time, and you're right, football and all these sports, they do have a lot of movement sideways and so on and so forth. Now, it happened to you, by the way, just the image that you gave me when you said buckled in, that I can just, it's almost like it gives you a little pain just to see it in your mind and not long to feel it in person. So I my heart goes to you. And I mean, luckily you're here today and you can speak about it, but I'm sure at that time, to your point, it kind of almost diminished all your opportunities in your mind. That's it. I mean, and you don't even know the outcome, whether you're going to come out of this and how you're going to come out of it and whether you can do things. Now, this wasn't, you said college. So that this was before you went to the occupational therapy school and all this stuff. So that's an interesting. So you had a severe injury. And by the way, here's the thing. You had one. Why didn't you stop at that point? I'm just curious.
It's a fantastic question. So I was going into my junior year. It was fall camp, junior year, when I tore my second one. And I had just I was kind of slow on catching on to the college football game. Everything's, a lot quicker. And to be good at football, you can't be thinking at all. And I'm one of those people who overthinks everything. So it got a while till I felt comfortable, making split-second decisions and actually thriving my spring ball of my sophomore year. And so essentially, I didn't want to miss. I had already missed my junior year, and I just wanted to, come back and make a bit of a name for myself my senior year. And unfortunately, I wasn't able to do that because I found out I was ineligible due to having too many credits. So I was very frustrated at that point, and I wanted to make sure, I got to get, and gave myself another shot. So I trained particularly hard, and I was able to go to a combine, and I ran some good times. and I was able to, get signed by a small arena team and sign my agent, who got me I let my arena football team coach know that if I got an opportunity to, continue to move up, I would take that. And I got a opportunity to work out with a Canadian Football League team in Ohio. So I went to that. And unfortunately, at the last rep of one-on-ones of that tryout, I tore my right ACL, which definitely kind of ended my career for sure. I knew I didn't want to do this a third time. That's for sure. So just essentially drive and, angry that I was missing out on previous opportunities is why I continued to come back. So.
Well, that's an excellent message to audience, especially the younger, folks who are determined and they do have their dreams and they want to make it happen. When something like this happens, I mean, you have to also think about all your options, right? And what that means to you. And again, in your case, yes, I had the injury, but I'm resilient. I'm going to make it. I still want to do this because that's what I want to do. And you went, but then eventually things didn't work out, and then now you got a further, severe injury, and that basically ended it. So, I mean, does that mean that? And again, now we can probably get into the psychology of it. Do people now at this point basically give up and they say that's it for me, or do people say, you know what, let me get back in shape and eventually go back? Now, that's obviously a question and decision that people have to make. But to what detriment? Is it gonna, do anything for them? Are you even? That's the other thing. I mean, are you even with that kind of injury? Would you even be selected by big teams and so on? So, because if they know that you've had something like that, would they even consider you, right? Even if you're good, maybe not.
Yep.
Right? So those are things that people have to put on the table as a decision makers, and really figure it out.
Yeah, each athlete's decision is totally personalized and unique because of their situation, how old they are, how many times they've had it, what kind of support they have, both physically and emotionally going through this process. It's all very unique for sure.
Well, you said now you went through this, but there was no real emotional support for you.
No,
you had to do it on your own, and and I'm sure that is a tough one because it's like it's all on you, right? And you have to keep motivated. You have to keep really inspiring your own self and pushing your own self and believing in yourself and doing whatever it takes to just keep up and just go through and heal first heal and then kind of get away from that trauma and that impact, right? So that was, how long did it take you just as a person to go through that, yourself, and then eventually kind of snap out of it, if I would use that word?
Yeah. So my issue, it's kind of something I always joke about with my fiance, is that I'm a extremely slow learner. So I actually didn't get through any of this. My book, essentially, I would have never written a book or learned any of these things if I didn't screw up even worse, than I had already up until this point where I tore my second ACL. So after my second second ACL tear, I started to abuse substances and started dating who I would find out would be a very severe alcoholic who was emotionally abusive, and it culminated in me being, suicidal for a time. After I was able to get out of that relationship, and as I was going through therapy, actually, believe it or not, was when I felt the most frustrated because I wasn't really seeing the progress that I was hoping to. My brain just wasn't, wrapping around the concepts that they're trying to give me at therapy. And it was extremely irritating for me that I knew I was doing what I was supposed to, but I wasn't seeing any progress. So I scoured the internet and found a different type of therapy called acceptance and commitment therapy, where its goals are a little bit different. And I can dive into that too if you need to. But essentially, traditional cognitive behavioral therapy, or CBT, looks to minimize the effects of your particular condition. In my case, it was, anxiety, depression, those kinds of things. Whereas acceptance and commitment therapy is more so looking to arm yourself for the inevitability of life, and that you're able to function at a high level, whenever those difficult situations do arise. And it does that by not trying to deflect something. So CBT essentially wants you to, if I have, perseverative negative thought. Mine was, I am broken, not only physically, but emotionally in this, part of my life. I would, revert that thought and, redirect it in whatever way possible, which is essentially, a clinician's way of saying, if they say, don't look over here, I'm one of those people that will stare in that direction, and, think that thought only twice as much. So it inevitably did not work very well for me. Luckily, I changed therapists, and it wasn't a magic pill, and I didn't miraculously get better all at once, but I started to take, slow steps out of that hole, starting my first session when I started working on my first psychological flexibility skill, because I didn't have any, skills as far as dealing with these things, because football was my coping mechanism. If I had a bad day the day before, I would go out to practice, get to hit someone, get a little tired, and I'd feel better. And even if I had a bad practice, I could watch film and figure out what to do for the next day to have a good practice or game. So it was kind of developing those things that I had missed out on in life because I had always used my sport.
Well, what you're bringing up is a super point, because that was your reaction, right? That's you, and it took you down a real bad road for a minute, because of you kind of basically starting to give up on everything, and then you wanted to just to cope with it with whatever comes your way, and you make some bad decisions, even going through some extreme potential deadly decision, right? And so that's the important message for our audiences, because this is what you don't realize a damage like this can do to you. Sometimes we don't see it. We don't think like, what would happen if I did this? We don't question, in advance. And the reason we don't question typically is because we don't want to know the answer. Because if you knew the answer, you'll be a lot more cautious and maybe not daring, and you may just give up and you say, I'm not going to do this because I'm too scared. And that's typical. Again, I give you the example of martial arts. I mean, you do get hit in martial arts, right? There's no joke. You go in and you got to feel punch, and you got to feel kicks, and you got to feel stuff, but you do it. But there's a point. I broke a couple of things myself in my career as in martial arts.
I bet.
And I can tell you, once you get that first hit, the second hit, you become a lot more cautious and a lot more, I am not going to do certain things. You start limiting to the extent of what you do. And now you practice more for fun, and you do it more like as a tradition. And I'm not into the competing world now. So you kind of change a little bit, because now, when shit happens, you're going to deal with it and no one else. I mean, unfortunately, that's reality. And there's a cost to this too. I mean, you're in college. I'm not sure if the college took care of you, but probably wound up all the bills were yours. And again, that's in itself could be a burden on someone if they don't have someone to support them, because nothing is cheap these days, right? I mean, the cost of healthcare is expensive. So and then when you're talking about psychology stuff, it's even worse, right? Because the cost is even more. So it adds up. But these decisions that we make, can literally become very bad for us in terms of outcomes. And some people would really go extreme and then probably just lose it, period, and out. Now, the good news is that didn't happen to you, or at least it happened, temporary, and you were able to snap out of it and cope with it differently because you found a different way, and it helped you. But then now and by the way, you said something very important, the fact that you were expecting an earlier or quicker fix. and because that didn't happen, because you set your own time frame of, and by the way, I know you go to a lot of doctors or a lot of providers, they will never tell you, oh, this is going to be quick. They'll tell you, depends on your body, depends on how you do your thing. And you're a doctor, this. Things will change based on the personality and the person and how much you put in. Not everybody's going to get the same results, and because of what you put in, right? Now, you as the patient in this case, you wanted a quick fix. And everybody would want that. I mean, who doesn't want to be like, I want to be back 100%. Sometimes you're never going to go back 100%, you might get 100%, but you're still kind of like, one little movement and then, puff, something can happen. So you have to be careful. But you did that. And it's important that you highlighted that, because that's an expectation that may not be real. And we need to make sure that if we're listening and watching right now, whatever the case that can happen to us, when things happen, the expectation that we set are important, and we have to always said that, we have to think about, let's hope for the best, right? But plan for the worst, because sometimes that's actually a better way to think about it than just be optimistic. I'm not saying don't, but the idea is don't just set up your standard like, oh, this is going to be easy, this that. You might psyche yourself a little bit and work with yourself a little bit, to kind of play the game. But in the long term, if we're not gonna, when you set something in your mind and then the results are not the same, what happens? You're disappointed. Now your reaction can be bad, right? And again, I'm not a psychiatrist or anything.
No.
But I use those systems myself, because I try to always do that formula and expect, I know things are going to get better, but I can't say, oh, it's going to happen today, because if I did that, I'm going to get too excited and nothing's going to happen. And then I'm like, oh, that's
defeated.
Exactly, defeated. So I don't want that. So that's how I use it. But I appreciate what you said there, because, for people, they don't realize that. And especially when it doesn't happen to you, it didn't happen to you, you would not see it. You would not, oh, that's just them talking. Those two guys are talking on the show. But believe me, folks, watching and listening, everybody on any given day can be surprised with some event in their life. And we are not prepared for those events. And even if we think we're prepared in any event. And a good example, who was prepared for a pandemic? Worldwide pandemic? No one. Maybe someone did, I don't know, but at least the majority of us didn't. And we were faced by a reality that was, the world locked down, not a country, not a state, not the world, for months. Okay, and we're still paying some of the price. I mean, the economy that came out of this and the whole stuff. So understanding that things can happen on any given day, we have to know that we need to have some sort of system in place. Now, obviously, this is not the topic of the discussion today, but the idea of just setting yourself, understanding that if you have something, that not to be too excited about a quick cure or a quick fix, because there's no such thing as a quick fix, not if the damage is extensive. So I just wanted to share that, based on what you said, because I think that is a big, really a piece of your work. You're helping people today. You're helping people to understand. And I'm gonna ask you, like, what that looks like for you when you're talking to your clients or your patients. What would be some of the advice you give them to actually maybe not fall into that particular trap, right? So now you said you wrote the book, but you took time to write the book. So what was the motivation behind the book, first of all? Is it the idea of putting your story behind and helping people? Or is it because you wanted to put some systems in place in the book?
Yeah. So essentially what happened with me is I'm a writer, just it's naturally who I am. I always have a lot going on in my head. And getting it down on paper has always felt very, very comforting to me to get it out. Otherwise, I have a million things swimming around in my head. So as I was going through therapy, my therapist wanted me to, journal about certain situations that were brought up in our sessions. And I started to do that, and I essentially, it culminated in all the stories that are in my book, depicting how using acceptance and commitment therapy or psychological flexibility would have assisted me in those particular situations. So actually, a lot of my stories are from my own therapy. And then I went back, obviously, and included all of the, scientific literature to make sure I wasn't saying anything that was, crazy or anything like that. I wanted to make sure I backed up what I was saying. But that's essentially how my book went. And I wanted to make sure to get it out there so, other people didn't feel like, they were just on an island as they're going through this, because that's how I felt. That, it felt very isolating as far as, say about 4 months into your injury, you don't have any crutches usually. You're walking fine. The scars are small. People always kind of expect you to start doing or in being who you were, but it's months before you're even a shell of who you were as far as the things you're able to do and those kinds of things. And you're just very, it's one of those injuries where it's pretty much completely internal as far as, you break your arm, you have a cast, those kinds of things. People can see you're injured, but a lot of times with these extended recovery, injuries, you look totally fine, but you're not. And you still have all those internal worries of, the self-esteem issues, the confidence issues. A lot of people are gaining their, confidence and self-esteem from their sports and how they, perform. And again, I said coping mechanisms, but also the fear of having to restart because of an additional injury. So it's definitely one of those things where it's very, very challenging.
So the book's name is Torn: Overcoming the Psychological Challenges Post ACL Injuries. That you know. All right.
Correct.
Good. So it's really your story, but your story is a story of many, right? So it's really you're depicted it based on your own experiences. But really a lot of people can relate to it. And I love what you said. And by the way, I always admire authors and writers because most of their stories or their books are based on reality and things. And again, I'm talking about the type of books that you write, that you wrote. But the idea is that you are doing it because you want people to know. You want people to actually have the ability not to fall in the same, level that you had and whatever that is. And at the same time to have at least to see the light at the end of the tunnel because they know what to expect. Now we're talking about expectation. You read the book, this is going to be a long journey and you need to have patience. There's ways, and you also give them some sort of level of, I guess, comfort because they know there are new solutions. There are things available to them, but they have to be prepared for the journey. And again, the whole thing is anticipation of anything can be a problem, right? So here they anticipate a good thing as opposed to a bad thing. Like, it's going to be rough, but eventually it's going to get better. And
exactly.
The fact that you are here talking about that's even further because now you're going out, and talking on podcasts, radios and shows and really discussing this with audiences of the world, share with them the value. Now, the other part is that not only you're sharing the value and your experience, but also now you can help them yourself because of what you do. Your work is helping people. So now let's talk about that. You've written the book. That's great. You had this experience and so on and so forth. Now you are in the world of helping people restore themselves. So first of all, you're doing this in the private setting. This is your setting.
Yep. Private for sure.
Okay. Yep. Now, and of course, I'm assuming this is open, to anyone who. So actually, the question would be like, how do you determine who would be qualified for your work? Because like we talked about physical therapy versus occupational therapy, or do people come to you with an injury and then you kind of help them, and guide them?
Yep, I deal on both the physical and the psychological side of things. Obviously, just due to the nature of my book, I get more psychological inquiries for sure. But a lot of times it's for people who, have had their, that's it moment as far as they know they're struggling. They know that they're starting to have other aspects of their life be affected by their injury, not only just their sports, but, it gets into their relationships, their schoolwork, maybe their career, depending on where they are in life. Generally, those are the people who reach out, or they reach out to me based on, they're having a lot of fear about returning to sport because the return to play conditions maybe aren't as strenuous as I believe they need to be, especially for ACL patients.
So again, I think that's a big deal, going back, and I know that fear because when you get hurt, it's like that's trauma, right? So how do you get someone really to kind of reassume their functionality and go back to what they were doing and assuring them that, hey, it's going to be better. It's going to be okay. That is a tough place to be because, again, one wrong move again, you will not see the same game. The game the same way, right? If you're going to football after a massive injury, you see someone coming, you're not going to be very pleased.
It definitely changes the way you look at sports, and it kind of diminishes that feeling of invincibility very, very quickly. So for obvious reasons, but there is a way to regain that as well. You can regain who you are. You just have to go through more joint specific training so you're not thinking about it all the time. Because a lot of times, even if you're graduating from the physical therapy clinic or the return to play protocols, you're still not feeling quite. You still don't feel quite the same, which is frustrating.
So now, what would be the length of work that you will go through with someone? I'm assuming it depends on the injury level, but I'm talking about the psychological piece of it. Because again, maybe you can get a physical aspect of things fixed in a particular time frame, but the psychology can be maybe longer because it all depends on the person, right?
Yeah, I mean, it's their situation. It's what their weaknesses are. It's, if it's strictly psychological, if it's both psychological and physical, I mean, the list goes on and on as far as um, what kind of length it goes with. It's anywhere from a month to, I've had infrequent talks with a football player out of South Dakota for over a year. So I mean, it just kind of depends what your situation is.
So, doctor, now most of the work is done in person, or there's some stuff that you do, like let's say people can be in a different state and still get to you and access your services if it's only the psychological aspect, I'm assuming. But if it's a physical aspect, or can you maybe recommend them to go places to get the physical part done if they're not actually local?
Pretty much everything I do is done remotely, much like we're talking now. I can also provide, examples for, um, physical things that they need to do all done remotely. I can demonstrate it and those kinds of things. But everything I do, the people I see are kind of scattered around the country, and that's why I go under, the kind of the guise of, acceptance and commitment coaching, joint specific coaching, because once you get into the minutia as far as licensing and those kinds of things, there's no reciprocity. As far as if I have a license in North Dakota, you can see patients in North Dakota, and that drastically, limits the amount of patients and people, ultimately you're able to help. And I want to make sure that I don't leave anyone on the hook as far as, that they're going through this and I can't help them because I'm not licensed in the specific state they're in. So.
Well, but I'm assuming as far as the psychology, it doesn't matter because you're coaching people. That's a difference.
Exactly.
Yeah. Well, again, that's important because I think we have audiences all over the world, literally, and many people may not even know that there is something that can help them in the psychological aspect of things, especially injury. Like you don't think about that. We all talk psychology, depression, anxiety, other things, but we don't relate that to injury and the damage. Or we may talk about it as PTSD in terms of maybe veterans or some other levels, accidents, and so on and so forth. But we don't at least I haven't seen that where sports injury and trauma, sports injury and psyche, trauma, PTSD. I mean, is that even a thing? Again, I mean, I know PTSD can be a lot of things, but what is that? Is that a real assessment for people that actually get injured, in the sport?
Yeah, certainly. There's a lot of literature that actually equates, the similarity between ACL injuries and PTSD. It's rather interesting because once you have one of these, unexpected, a lot of times traumatic injuries, I mean, you have a really hard time doing even the small things again without, fear of the knee just giving out on you unexpectedly.
So, well, doctor, so one thing that comes to mind is that sometimes in psychology or even physical therapy, there's also use of medicine. Do you do that? I mean, do you recommend medications and things like that if needed?
I have obviously taken medication, but it's not something that I like to recommend. I usually refer those to, someone else, just because it's not really under the purview of therapists. Generally, unless you're a very licensed, I believe that there's specific instances in when a psychologist can, but I would claim ignorance as far as how frequent that is. Usually, it's MDs like psychiatrists and the like that are recommending medications. I pretty much everything I do is more holistic. So
I love it. Now, are there any? I don't know, maybe because we talked about the injury itself. Is there any nutrition, aspect to this, process that you have?
Yeah, there is, specific dieting things that always help. I mean, being in a better nutritional place is always, advantageous, especially as you're going through a rehabilitation, time period in life. So there is a lot of literature that says, the higher your BMI is, the more likely you are to have joint injuries, especially ACL injuries. So it's definitely advantageous to make sure that you're, as streamlined as you need to be. I don't ever advocate for, anything unhealthy, but just a more natural diet as far as less processed foods and those kinds of things is always very, very crucial to the healing process.
All right. So Doc, so where can people actually reach out to you and benefit from your services?
Yep. So you can find me at theacltherapist.com, and also on Instagram and Twitter at the ACL Therapist.
I love that ACL therapist, and it's pretty unique. One thing is the book, obviously Amazon, right? That people can
Yep.
purchase a copy. Is there any other book in the works? Just ask.
All those thoughts rolling around in my head. I actually have a couple, other nonfiction books, as well as a couple, God willing, if I ever get time, novels I'd like to write. So.
All right. Well, listen, we look forward to those. So we're at the end, top of the hour here. And so my question to you is, any advice to our audiences watching and listening right now?
Yep. I'm always a huge advocate for living in the moment. I think nowadays we're all sucked into, one of the 4 million Netflix series that just came out, or social media is a huge time suck that, provides very little value in our life. So I think putting the electronics away and actually living in the moment, cultivating actual real relationships, and getting better in the ways that you actually can are something that we all need to focus on a little bit more. And it's one of the psychological flexibility processes and skills. Living where you are is very, very important.
So I unfortunately, you just opened up a whole Pandora's box there. But here's a question for you though. I mean, there's a lot of opinion in social media. What do you tell people that are watching right now, listening, that may be going through some sort of trauma, post-trauma, in terms of injury? Because there's a lot of stuff that, people that are not experts, that are talking about everything on TikTok, especially TikTok. I mean, it's huge. Anybody has an opinion, they go in there, and which, by the way, they're entitled to it. But for people, we have to take things with a grain of salt, right? Not everything that they hear is correct, and they always have to, do the due diligence process. So what's your take on that? I mean, I get it. You're not a big fan. You want people to actually live a good old-fashioned social life, which basically actually I left. My daughter has this hoodie, and it says, I'm a member of the what is it? Social club of the non-social, something of that. It's just one of those, it's funny ones. And I'm like, I get it. but really I understand your point, because it's really the truth. We are all caught up in this new way of living, and we are so social online, but we are not social in life. And it's sad, right? I mean, it's a lot easier to make friends and do stuff and comment and talk and do all the stuff, at a push a button, as opposed to actually meeting with people. And what's sad is that you can be sitting with people literally on the same table, and everybody is, I watch this, you go on the street and you see people sitting on a table, family. Everybody's looking at their phone while they're actually having dinner or lunch together. I'm like, what's the point? Again, that's not our topic, but just the advice that you would give in terms of opinions and advices that are available readily in social media that may or not be correct.
Yeah, I would always stick with individuals who deal in that space. And one of the things I would also note is someone who's obviously qualified, but secondly, is it someone that's trying to, profit off of you? So if they're only selling something or if they're only talking about something because they're selling it and not because they're wanting to help people, they might be right, but I always question those individuals just a little bit more, because any salesperson will sell. Any skilled salesperson without a moral compass can make something sound advantageous or correct. It's the people who are providing content that they're not actually, directly benefiting from. They're just trying to help people. I would look for those individuals, and they would be a wealth of knowledge. Unfortunately, there's not ample of those kinds of individuals on social media. So,
well, listen, this is what we do. This, right? We bring the actual resources and the real McCoy, the real folks that actually do this for a living, to provide guidance and a resource as well, so people can reach out and get the information direct. And by the way, again, I'm not downplaying the role of social media. I mean, it has its own play, but like I said, do your own diligence no matter what. You don't just have to hear everything and just take it for it is. Like, we hear a lot of things, and it's not the news, it's not the real, and even the news, you still have to do your own work. I mean, you just don't take it because you hear it from someone. But especially when it comes to your health, I mean, there's a lot of stuff and there's a lot of debate at all times. There's plenty of opportunities, plenty of resources. So just find the right resource and basically do that. So again, that's you just talked about. I had to. I'm sorry. All right. Well, listen, Doc. It was fun. It was real. Thank you so much for sharing your story, your work, and continue doing what you're doing, helping people. I mean, that's always honorable, and I admire people that are actually helping people get better and giving back. So thank you so much for the work you do.
My pleasure. Thank you for having me.
Pleasure. So that being said, folks, we're coming to the end of the show. Hurricane H here. We'll be talking soon. New day, new show, new topic. Bye for now.